Welcome to the Vanderbilt Maternal-Fetal Medicine Fellowship Program. We're excited that you have decided to spend some time with us and get to know more about our fellowship. We know that due to the pandemic this year, you're unable to travel to campus and may not meet as many of our faculty as you normally would. We've put together this video to introduce you to some of us and let you know a little bit more about how we love Nashville, Vanderbilt, and the fellowship program.
I love Nashville for so many reasons. Coming from the Northeast, I was not certain I would love Nashville as much as I do, but my husband and I agree that this is just the place that you have to be.
My priority is to be outside as much as possible when I'm not working, and that's pretty easy to do in Nashville with all the greenways, and I really like to run and to golf and to be on the lake, so that's easy and fun to do here.
That's pretty easy. What I love about Nashville is the fact that it's kind of a bit of a small town feel, but yet has all of the benefits of a major metropolis.
My favorite thing about the Nashville area is that every weekend you can find a farmer's market or a craft fair to go to.
You're driving distance to the Smoky Mountain National Park, which is incredible, and driving distance but a little bit further away from great beaches on the Florida Gulf Coast.
So Nashville's a great place to be. It's a very fun, a very alive city with lots to do, lots of live music, concerts, lots of things to do outdoors. There's plenty of state parks nearby, so places to go hiking, kayaking, rafting, camping, all that good stuff.
I would have to say that one of my favorite things about Nashville is just the incredible restaurants that we have here. The local food and restaurants are just fantastic.
And I just feel like no matter what you love to do, Nashville does not close doors to you.
VUMC in itself is a great place to work. We have a lot of complex maternal and fetal cases that you'll see here, including a very large cardiac population. And we also have a very large fetal center where we get multiple referrals.
I think what really strikes me about Vanderbilt is the culture of family that Vanderbilt has. This was really apparent to me when I came to interview for jobs, and not only did I feel supported in my personal family, in my personal life, but also in the way that Vanderbilt creates support and creates a Vanderbilt family.
What I love about Vanderbilt are the people here and the team dynamic. I feel like because Vanderbilt has such a high value for quality of care, collaborative care, and evidence-based medicine, you really see that in the quality of the people that you're working with.
Vanderbilt as an institution is an incredible place to learn and to train. You'll find that your colleagues in our department and throughout the entire healthcare system are incredibly supportive, collegial, easy to work with, and are really committed to taking care of patients.
What I really love about being at Vanderbilt are just the great opportunities that are available for collaboration both within our department and outside of our department and through the larger university. I am in year 2 of a 5-year career development award that examines opioid prescribing after childbirth, funded through the National Institute of Drug Abuse. And I work with people in health policy, public health, bioinformatics, biostatistics, and I'm just continuously impressed by the great leaders and mentors that are here at this university.
And my favorite thing about VUMC is that I always feel very supported and also very valued by my coworkers and the whole department here.
Anything I could possibly imagine, if I come up with a plan, it will be made available. I have found that I have been more supported in academic and personal and professional endeavors than I have ever experienced at any other institution I've worked at.
I think that one of the things that makes our fellowship so unique is the depth and breadth of MFM that we can offer. We have a very robust fetal program, including fetal surgery, as well as a high acuity maternal program, seeing the full scope of maternal diseases. In addition, the hospital has all the pediatric subspecialties, which allows us to continue to care for very sick fetuses. In addition, being a newer program allows us that opportunity and flexibility to truly make the fellowship what you want. The offerings that are available at Vanderbilt throughout the hospital allows us that opportunity to truly shape your fellowship into what your interests are. I think that we have an outstanding and full fellowship that's going to offer you everything that you're looking for.
There is a culture of kindness and collegiality, which I think is notable and appreciated. And within the MFM division, there are a lot of different providers with different clinical experiences and different training perspectives, and I think that offers a breadth of perspective for fellow education as well.
You know, coming from many different places gives the benefit of learning different kinds of management styles and different solutions and ways of doing things, and I think that just really enriches our program.
One thing I think that makes our program unique is that we have a fetal center, so we get exposed to some fetal intervention and therapy, which is super cool.
One strength of the Maternal-Fetal Medicine Fellowship at Vanderbilt is the robust collaboration between the genetic counselors and the maternal-fetal medicine specialists.
The fellows spend a significant amount of time in our genetic counseling clinics seeing patients that are specifically referred for genetic counseling. So we're really able to work closely with the fellows in their genetics education.
Everyone is just willing to share research ideas, clinical best practices, and teaching tips.
And I feel like what we've created is a program that encourages learning, encourages being challenged, encourages academic prosperity, while also giving our fellows time to grow as physicians and grow as researchers and grow as learners without being overburdened by the service that you'll often find in big academic centers.
Thank you for taking the time to watch the video today. We can't wait to meet you during your interview day, and best of luck. Thanks for watching.